Hello, my name is Liz Tyser, Public Health Emergency Coordinator for Johnson County, Kansas. This Dispense Assist training is brought to you by the Johnson County Department of Health and Environment with funding provided by the Centers for Disease Control Cooperative Agreement. All information provided in this training is for educational purposes only and should not be relied upon solely for emergency planning purposes. Processes, products, and trademarks shown are only for examples and do not reflect a specific endorsement of any product. Dispense Assist was created and is maintained by the government of Johnson County, Kansas. There are a variety of prerequisite trainings recommended before completing this training video. These prerequisites may help you better understand the statements, processes, and basic principles referenced but not discussed during this video. Basic Public Health Emergency Preparedness, ICS 100 and 200, and NIMS 700. The following topics are covered in this training: Dispense Assist process, how to provide pills, summary and local information. Dispense Assist was developed by the Johnson County Department of Health and Environment as its solution to the medical countermeasure requirements of the City's Readiness Initiative, or CRI. The planning standard requires the entire population of a jurisdiction to be provided with life-saving medical countermeasures within 48 hours of the decision to provide them. For Johnson County, that's over 500,000 people. Dispense Assist was conceived as a local solution based on the work and research of health departments in the San Francisco Bay Area. The screening algorithm, question methodology, and written protocol were all developed in the San Francisco Bay Area, but used with permission to develop Dispense Assist. DA works by allowing the public to complete their medical screening online before dispensing sites open, thereby expediting the dispensing process. As a closed-site partner in mass dispensing, it is important to understand how Dispense Assist can be used. The following is an example of a closed-site dispensing process that uses Dispense Assist. This process may differ from the closed-site plan in your jurisdiction. The Dispense Assist process is very simple. In the event of a bioterrorism incident, you send out a notice that you're activating your closed-site dispensing plan. Your plan should include how you will notify your internal staff and how you will notify clients that you are opening your closed dispensing site. Inform clients what you are going to provide them, how you will provide it, and include instructions on how to access the voucher online. Let them know if your organization will deliver the medications to them or if they'll be required to pick them up at the closed site. Indicate if the client can pick up medication for their entire household. Who can receive medication at the closed site will differ by jurisdiction. Some jurisdictions will leave it up to the closed site to determine who their target population is. Some jurisdictions will already have that population identified. You can confirm this with your local or state public health agency. Each closed site will need to follow their established process for dispensing and work closely with their public health agency to ensure the plan is adequate. The following is a general dispensing process. People arrive with their completed vouchers. Different jurisdictions will have different processes, but in general, if they have their voucher, they are immediately directed to the dispensing line. If they do not have their voucher, they're instructed to complete one on site. That location may be off-site like a library or a school computer room, or it may be a kiosk right there at the dispensing site. Each jurisdiction chooses which process they want to use. Individuals who are directed to the dispensing line will have a printed voucher containing the demographic and health screening information. At the top, a letter or a group of letters in the upper left-hand corner indicating which medication the individual can receive. A C indicates they have been medically screened and can receive ciprofloxacin, or Cipro for short. A D indicates they have been medically screened and can receive doxycycline, or Doxy for short. A C/D indicates they have been medically screened and can receive either Cipro or Doxy. If the individual can receive either, the jurisdiction's protocol must indicate which medication is to be dispensed. This could be as simple as stating, in the event of a C/D voucher, Doxy is the primary medication. Persons with an X should be directed to either a supplemental screening station on site, to their own physician, or to a physician partnered with the jurisdiction for further evaluation and medication provision. Each jurisdiction will have their own protocols for handling these individuals. The closed site plan should address if clients are coming to you or if you are taking the medication to the client. The plan should also address who is able to complete forms for clients, staff or supervisors, family members, or the client themselves. The label is removed from the pill bottle and placed on the voucher. Each bottle is labeled with the correct name and date of birth. The individual is provided the FDA-required emergency use authorization, as well as any other required handouts, and reminded to take all the pills as directed and to follow up with their physician. The voucher is kept, and the person is instructed where to exit. The entire dispensing process for one voucher should take less than 45 seconds. If the individual has multiple vouchers to process, each additional voucher should take less than 30 seconds to process. Simply put, when dealing with pill dispensing, the following basic information applies. 1. Something has happened. 2. A decision is made to dispense medication. 3. A message is sent out to the exposed population to complete their voucher. 4. People arrive at the designated location with their voucher. If someone does not have their voucher, they are directed where they can complete one. 5. Individuals with a completed voucher are directed to the medication dispensing area. 6. The appropriate medication is dispensed based on the voucher. 7. The person exits with their medication. Please go to www.dispenseassist.net for the latest information.